It was 2015 when the board of the Alliance established the Healthcare Transformation Award to recognize organizations and individuals who are having a positive impact on healthcare value. In alignment with our mission of controlling costs, improving quality, and engaging individuals in their health. Changing healthcare is not easy, and each of the recipients of this year's award are courageous, tenacious leaders who are making a difference. Our next recipient is Walker Forge. And Will Walker, CEO, and Mark Gelhaus, CFO, are great examples of the progress that employers can make when they roll up their sleeves and take control of healthcare. We've got a short video that describes their efforts and tells their story to get high quality healthcare for their employees at a more affordable price. Let's take a look.
Walker Forge is a 72-year-old family company started by my grandfather. I'm the third generation CEO. We make steel forgings for a variety of different companies and customers across the country. The impetus for our getting involved in healthcare transformation was year after year of the same thing: higher premiums, getting less and less for our money. Our employees were paying more and getting less. And I really felt like I was failing our employees. I felt like I needed to get engaged as the CEO and see if we can come up with a better solution that would help us as a company be more competitive and would help our employees by providing more affordable but yet great quality health care.
You know, healthcare costs the second or third highest expense on most companies' income statement. So we need to spend more attention to it. A lot of companies, including us, didn't. You know, we manage our pens and pencils, and in our manufacturing plant. When it comes to healthcare, we just kind of let that up to the brokers to kind of manage that for us. And we started to get some input that we can take charge of this. And the first step was becoming self-insured.
Self-funding is necessary, but what's really important is being self-funded with the right partners. We've applied it with great success over the last 5 years, to the point where our all-in healthcare spend per employee, which is our main metric, is 28% below the national average. And our pharmacy spend is about 1/3 of the national average per employee. We collaborated with 3 or 4 employers to start a employee clinic, a free clinic, where our employees could go, and their spouses and dependents could go to get free primary care. This has been a tremendous win-win for everybody. Our employees get better access, they get great care, they don't have to pay anything out of pocket, and we are not beholden to the major health system in town. There are a lot of employers who just aren't aware of what can be done, what tools can be used. And so we've actually organized best practice seminars where we have probably 40 employers come just to learn what they could do to better control healthcare costs. We like that leadership role because we really care about sharing and helping transform healthcare in Wisconsin.
Once you start to have success and see how your costs start to go down, then it doesn't become work. It becomes satisfying. It's so satisfying that you're saving costs and you're improving the plan for your employees.
We have so much respect for the Alliance and their mission and what they do, not only for their members, but for companies across the state. They have a tremendous influence, and they're doing great things as an organization. And so when the Alliance singles out Walker Forge for this award, it's quite an honor, and we are just thrilled to be able to accept the award.
Will and Mark are remarkable, not only for the work they're doing on behalf of their employees, but also for the tremendous leadership they've shown in the policy arena. Last legislative session, a bill was introduced that would, if passed, would have increased prescription drug prices. The bill would have prohibited self-funded employers and insurance companies from using lower cost suppliers of medications that need to be administered by a clinician. Instead, we'd be forced to buy those drugs from hospitals, which mark the price up on average 200 to 400%. Will and Mark went to work. They reached out to business leaders from across the state, resulting in this letter that includes signatures from over 100 companies in the state. You have this in your packet, and it's also available on the webinar in the handout section. This letter made a big difference. The bill didn't pass yet, but it will be back this next session. And I can't emphasize enough how important it was, the work that you did to galvanize the business community and get people to sign on to this letter. If your name isn't on here, we encourage you to consider signing on. There's a sign-on sheet in your packets and also on the webinar. And you can complete this and leave it out on the registration desk. We need your voice. It's making a difference. Will and Mark, our thanks for the work that you've done at Walker Forge and in Wisconsin. It's great to be able to recognize you.
Thank you very much, Cheryl. As you know, Mark and we've become very passionate about healthcare and doing our part to fix the broken healthcare system. And so we are truly honored to receive this Healthcare Transformation Award from the Alliance. So thank you again. I have a few brief remarks that I'd like to make. First, a huge thank you to the Alliance for working to make high quality healthcare more affordable and more accessible to the people of Wisconsin. The Alliance is a tremendous partner and plays a tremendously important role in healthcare and improving the ability for people to access and to get the healthcare they need when they need it. There are several partners I'd like to thank for helping Walker Forge on its healthcare journey. Thanks to our employees for their buy-in and trust. Thanks to our advisors, Sarah Hamas and Megan Zimmerman, for bringing us innovative and disruptive strategies. And thanks to our partners who work with us on a daily basis to provide high quality, affordable health care. Our independent TPA, our innovative pharmacy benefits provider, our healthcare navigator, and our primary care clinic provider. And thanks to all of you who are here today. We need more people to get involved and engaged in fixing our broken healthcare system. There are all kinds of reasons to get more engaged in healthcare, particularly at the C-suite level. The most obvious reason is economics. Getting control of your second or third biggest business expense is essential to protecting the financial health of your business. But to change the dynamics of our healthcare system, we need greater numbers of employers to get engaged. Another equally important reason to get engaged is to protect employees. Soaring medical costs are a heavy burden. An employer who can provide high quality, affordable health care has a tremendous advantage when it comes to attracting and retaining employees. At Walker Forge, our employees have access to free primary care and specialty care, and their payroll contributions for healthcare coverage are well below average and have remained flat for 3 years. Our employees greatly appreciate that. Finally, one more reason to get engaged is to protect your company against the powerful healthcare interests who are actively working to restrict competition and increase profits at the expense of employers and employees. The recent anti-white bagging legislation pushed by special interests is a perfect example of this phenomenon. So in closing, there are compelling reasons to become engaged in the fight for high quality, affordable health care. Thank you again for this great honor.
The Alliance, keep up the good work, and thank you.